want to take the kids out of the room. We've asked Raul to leave the room, so you might want to do that too. Our child is out of the room. So, okay, everyone knows that smoking is bad. We got this. But some new studies prove it also has a direct effect on sexual dysfunction. And joining us is Dr. Irwin Goldstein from San Diego Sexual Medicine, Alvarado Hospital. Hi.
How are you? Thank you, Chrissy, for
good to
doing this.
see you. There's a new study talking about sex and smoking.
For women.
Now, everybody has seen the scenes in the movies where the people have the sex and then the people light the cigarette and smoke. I mean, it's kind of a classic scene or a theory. So do they not go together?
Well, so advertisers would like you to think that this is glamorous and you're an independent woman and you will lose weight. And it's an addiction at the end of the day. It's a drug addiction. Dopamine is released. You would think dopamine would enhance your sexual function.
Is that what cigarettes do, is they release dopamine?
Oh, very much. Nicotine releases dopamine, that gets you going.
Oh, okay, so that makes you feel happier. So that's the addiction, and that is other things.
Oh yeah, that's we're very well documented. The drug Chantix stops the nicotine release of dopamine. That's how you stop smoking with Chantix.
Interesting. Well, that's really interesting. So what did this study show about how the effects on sexual dysfunction?
So this is about women. We're now interested in women's sexual function. October 17th, the drug comes out.
Thanks to you.
We're doing a Sex in Our City in October at Alvarado Hospital, a community program, free, so the community can listen. But 175,000 women die annually from cigarette smoking, lung disease, heart attacks, strokes.
Heart attacks. Yeah, it's the number one killer, isn't it, heart attacks?
Cancers. I mean, it's a bad thing.
Not even in the DNA. You just smoking cigarettes and you got hooked and then you die. You die early. But we're talking about like the sexual function or their lack of. How does it harm your sex life?
Yes, so there's no data on this for women. So finally, this group did 900 women.
Yeah.
Ages 30 to 47, so these premenopausal women.
Okay.
We know that it adversely affects pregnancies. We know that adversely affects a whole bunch of bad things. But sexuality, one would think, especially with the sex scenes that you're talking about, would be greater. So just like men, chronic cigarette smoking is bad for sexual function. So in 900 women studied, those who are current smokers had far less sexual function than those who were former or non-smokers.
Okay, so meaning they didn't have a sexual desire. It was harder for them to kind of, I don't know what word I can use in morning news right now, but like what's the word?
Climax?
What you said. Yes.
There's four. There's a.
Is that what it is, or
so,
what?
So the study gave women a validated outcome measure of women's function.
Okay.
4 out of 6 domains were statistically lower in current smokers versus former or non-smokers.
Or any higher?
No, not
okay.
higher.
Just wondering.
So arousal, lubrication, the climax thing, and pain.
Oh.
Were much lower. Well, higher in pain and lower in the other
Interesting.
3. So also it related to pack years. So the more you smoked, the more often you smoked, the duration. Pack years lowered female sexual function. And nicotine dependency, another interesting measure. When you wake up in the morning, how quick you rush to the cigarette.
Yeah.
So if you have strong nicotine dependency, you had far less far less sexual function.
Oh, interesting.
So there's some good news here. You know, one thing is to not smoke, to really stop that.
Awareness, insight, information.
You think you're doing well, you think you're activating sex life, but it's not true.
We're lifelong learners, you know, we all make mistakes, you know, it's like you get hooked on the cigarettes, you're out smoking with your friends when you're 16, you know, 30 years later you're still smoking, right? You know, it happens. But there's help. So, Dr. Goldstein, thank you for being here.
Well, thank you,
and
thank you.
Again,
the other thing is former smokers don't have the risk. So stop.
Right.
Then you won't carry the risk.
Okay, Dr. Goldstein. If you want more information on this, go to our website, fox5sandiego.com, and click on the Scene On tab. Raul?